Hey there, everybody. I'd like to welcome you to today's presentation. Today, we are talking with Paul Lawler of Aftercare Decoded. Welcome, Paul.
Hey, thank you for having me.
So can you tell us, before we get started, a little bit about why you started Aftercare Decoded?
Absolutely. Thank you for asking that. Being involved in the industry for around 9 years, one thing that kept presenting was the stepping down and getting clients prepared for going home and what to do once you're home. So the passion of seeing people succeed really motivated to think outside of the box, like looking at the specific highlighted common denominators of people going home and then having hiccups or issues and or inconveniences. And I wanted to put together a specialized team who understood the importance of environment, people, places, and things really needing to be challenged and willing and ready to embrace the loved one coming home.
Excellent, excellent. And I don't want to get ahead of myself and give away too much stuff, but we will talk a lot about the importance of the transition and using a trauma-informed, compassionate approach to this process. So let's start out with the basics. What is aftercare and kind of why is it important?
Well, to sum it up is, aftercare is an ongoing support for people leaving treatment. When you look at aftercare, you're including such things as like counseling, groups, med management, which is I find to be a huge struggle within our community. Having that accountability. So aftercare is really the accountability and facilitating the knowledge and progress that you received while in a program, because situations are going to evolve as so much as your coping skills are evolving. So it's not a one size fit all. So that's why aftercare really helps continue to build your toolbox.
And one of the things I talk about in some of my classes is teaching people information and these skills in terms of KSAs, knowledge, skills, and abilities. We can teach them about cognitive distortions. We can help them learn the skills and practice it in group.
Yes.
Until you are in the real world trying to apply it, I always get in vitro or in vivo mixed up, but in real life, you don't know if you've actually got it. You think you're pretty confident. And I remember going through graduate school and we would learn these different techniques like motivational interviewing and blah,
yes.
blah. And I'm like, okay, I've got this. I feel confident. I know how to use this. And I'd be in a session and going, well, not sure exactly how to tailor this to the session. So what I'm hearing from you is aftercare is really helping people translate those skills into abilities.
That's the thing. The exposure is key, okay? Because like you said, we can facilitate thoughts and beliefs in a group setting, in a secure, setting. Sorry to repeat myself, but once you go home, the action, putting in action, there's a brief moment of lack of confidence or self-esteem, or being able to mentally go back to these new coping skills and putting them in action because it's the first time with exposure, being able to show success or where it needs to be fine-tuned. But without being in the middle of it or that exposure concept, it's really a guessing game. Is that fair to say?
Yes, I think it's very fair. And I think it also kind of builds on the fact that when people they leave residential and they are leaving a safe environment for a chaotic environment, maybe not unsafe, but likely chaotic. And there are triggers that they can't control. Residential is very controlled in most cases. So when they move on to that natural environment, there are more triggers. They get triggered, they go into fight or flight stage, and we know we don't think well when
not at all.
Fight or flight. We drop back to our automatic behaviors. So when people are in early recovery, and I use that term really loosely, first year, 18 months, they are still encountering new situations. They're still getting triggered, and they're having to strengthen those pathways to the new coping skills. And if they don't use them, and one of the parts that I find interesting, I guess, is when people are out there and they don't use the skills they have, they get so frustrated. They're like, I knew better. I shoulda, coulda, woulda. But you didn't.
But that's damaging verbiage. That's damaging verbiage right there. Self-talk right there. Should have known. I should have done. Not fair.
Exactly. And saying, okay, well, but you didn't. And using that radical acceptance and saying, let's get curious. And in Aftercare, the groups that I've run, I've always encouraged people to look back and go, all right, that's what happened. So let's look at why it happened so you can prevent it in the future, or try to prevent it in the future. It's not something that is necessary to beat yourself up over, because that's just a waste of energy.
But that's what makes you so good at this is providing and facilitating that self-reflection, looking at it step by step, not to shame, but to grow, and understanding the missteps and not what we could have done better, but what we learned about ourselves in the process for the longevity.
And you may find that people can do things in one setting, but not in another, or do things on Tuesday and not on Thursday. And that can be really frustrating too. Again, going back and saying, what was different? What was different, so we can learn from it and tune up that relapse prevention plan.
Amen.
That's all it is. So can people go directly from detox to aftercare?
They will tell you yes, but if you want to know personal belief, I think it's just prolonging the inevitable. Because look, detox, agree or disagree, detox is meant to get physically well, and it allows you to maintain or not maintain, but be introduced to your thoughts, your beliefs starting to come to surface, and this is where the work gets done. So what you're doing is you're cutting out the work. You're going physically well to going back and integrating into a life without giving yourself the time and the gift of the knowledge that's found with the individual sessions, the groups, a sober community, med management, and figuring out any type of hindrance with medications, good or bad, and allowing yourself the time to filter through that. So yes, people will tell you, hey, I can go detox to home. That's their belief. But why sell yourself short on this experience?
And with detox, a lot of places, not all, but a lot of places, detox is anywhere from 3 to 7 days. So the people aren't even physically well when they're leaving. And that's one of my big pet peeves about some of these rapid detox centers and stuff, and even regular ones, that they tell people, when you get out, physically you're fine. You are completely healed. I'm like, no. Their liver is just going, hello?
Yes.
The neurotransmitters aren't balanced. The gut microbiome is still out of whack. So yes, they are medically stable when they leave detox. But as far as being healed, being in recovery, no.
Not at all.
Or clean, depending on which term you prefer to use there.
Thank you for highlighting that.
But it's really important for people to recognize that there's so much work to do. They used for a reason. And if they don't address that reason, they're going to use again.
Well said.
It's that simple.
But that's the unsaid truth. A lot of times people talk themselves out of that understanding, because if I feel well, I can act well. And that's not the correlation between the two. There's some baggage, like you said, the reason why we use, what is the underlying issue? And we have to take time in exploring traumatic impacts. If we, any type of misplacement or displacement emotionally, mentally, and the things that we've been masking throughout the years. If I may, can I give some self-disclosure on that?
Please.
Okay. So, as I was 28 going through detox myself, okay, and not really understanding, I thought I had an anger issue. I didn't think I had a drinking issue by any means. But the reason I'm disclosing this is this: I bought into a lot of false beliefs. And I figured once I had my anger taken care of, the rest of the life would follow, which was inaccurate, okay? And when I was able to go into my individual session, because of group, and that's why I love groups, group saved my life. Group gave me the confidence to address things that I thought I was uniquely broken in. But I wasn't uniquely broken. There were others going through the same pain. I had some stuff that transpired in my childhood, and a lot of my anger and aggression or trauma responses were triggered from this because I was overcompensating with vulnerability and going through as if I had to protect myself under all circumstances. But when the gentleman in group opened up, and he gave, still to this day, he doesn't know he gave me that permission to work on myself unknowingly, I was able to get with my therapist and disclose to them what I had been hiding. And real work started getting done. Does that make sense? Like I was able to address these underlying issues of why I was drinking, why I was reacting in the manner, and then able to diffuse and rewire.
Mm-hmm.
So
there is a lot that goes into it. And I'm glad you brought up group, because I think group has two beautiful contributions to the recovery process. One is to provide that sense of hope and courage and optimism, and helping people feel not so isolated, not so unique. And group, as well as counseling, but group especially, I think is really good at doing something that we call the Johari window. Are you familiar with that? Where it helps us learn about our blind spots, those places,
yes,
those things that other people know about us that we don't know about ourselves. And that is so powerful in group when somebody can say, hey, you know, it seems like you're not doing so well right now and you're in la la land. You're like, I'm great. But they see it and they say, no, this is what I'm observing.
You know, I built one of my groups off of that approach when you introduced it, you know, and it's some people use it as like a point out chair, but it sounds like that, but it isn't. And what it is being able to express how you view yourself to your peers, to your community. And what they do is they give you feedback on the things you're not seeing. And it's out of love and care in order to encourage the change. And while you have the allotted time to be removed from situations, it's to fine tune and actually work on those blind sides.
And I don't want to go too far down this because that's not what we're here for, and during that group, it can be so powerful to say, take what's useful, leave the rest.
Yes.
It allows people to be able to learn how to hear things that they may not want to hear without responding with that anger.
Correct.
Be able to hear it, take it in, and then decide, is it useful? If so, okay, great. I may not like it, but I can use it. Or, you know, this person's way off base. I'll just, you know,
But that's where the personal work begins, because now you have a decision to make. Are you going to take it and work with it, or are you going to leave it there?
Right, exactly. So aftercare is really, for a lot of people, is something that begins, unfortunately, in my opinion, right after residential and continues on. And I say unfortunately because I've made the analogy before of being in treatment in residential 24/7. It's like living in your parents' home. And then you go off to college.
That's a different way to put it. I like that. That's different.
Living in the dorms, and, you know, I can tell you life is much different. And there are a lot more triggers and there's a lot more stuff to cope with. And it can be overwhelming all at once. Whereas if it steps down like it's technically supposed to, the intensive outpatient, then outpatient, it helps the person ease into that transition. You know, IOP meets several times a week so they can regularly contact and connect with their therapist. Now, 12-step programs do a great job of helping bridge that gap because, you know, that whole 90 and 90 is really helpful for a lot of people because they're having to become mindful at least once a day.
Yes.
But for a lot of people, 12-step programs themselves aren't enough. And so I'm curious, and I think that's kind of one of the reasons you may have started Aftercare Decoded, was to help those people who weren't getting what they needed, not because the rooms weren't supplying it necessarily, but because they weren't taking it, and helping them apply it. So can you talk to that?
Yeah, it's like looking at it like this. My belief, my personal belief, is that there has to be a marriage between, you know, the 12-step program and therapy. That's, looking at it from both angles. They complement each other in all honesty. When you look at a therapeutic approach, looking at the inner workings of it, you need appointments, and sometimes you only get to see a therapist once a week. Group may only be, if you're in IOP or OP, you might be going 3 times a week for 3 hours. So it's not, I don't want to use the word limited, but it's structured and scheduled, where your 12-step approach has a whole community as needed. You can go into a meeting, some places offer them, up until 11 p.m. And there's no copay, and it's a community who cares. But I love the 12-step approach. Going into the 12 steps where you're challenged to find a higher power, or, as you come to understand, working through, personal reflections, when we can take our inventory and look at our actions and all of these, situations, it allows us to continue to challenge our perspective while growing. And the beauty of it is you're with people who are showing up because they care, and it's huge because, like I said, not saying it's wrong, but the culture of therapy is appointments.
And which I think can be beneficial because that requires accountability and it discourages dependence.
Correct.
I don't want the people that I work with to be dependent on me. I want them to have a support network. I want them to feel empowered. And the 12 steps provides that, in many cases, that community like you're talking about. And if they're doing what they're supposed to do and they get a sponsor,
yes,
because life happens, and generally life happens at 2 a.m, not
always
in the afternoon, the sponsor is there. So you're never left out there flapping like a fish out of water for 3, 4, 6 hours until the office opens.
Yes. And
that is so crucial for a lot of, well, I think for everybody, to have that kind of support 24/7, 365.
It's beautiful. You allow opportunity of success and support rather than limiting the support. And you're absolutely right. A sponsor will pick up at 2 a.m. Mm-hmm. And if your sponsor does it, by that point, you should have a sober network to where you're calling 5 people. You keep reaching out, and it encourages that reinstates that, don't be afraid to ask for help. Mm-hmm. It's not, a lot of times it's interwoven with embarrassment or weakness or, the shame of the belief I'm not doing the program correctly if I'm having cravings, if I'm going through a post-acute withdrawal syndrome, if something in my life has shifted to a point where I'm not okay. It's all right to walk it through and receive that support. It doesn't negate the efforts you put into your sobriety.
And too many people think that they get out of detox and maybe even out of residential. They start feeling better. And then because post-acute withdrawal is so episodic, then they start having cravings again 4 months later, and they feel like they have failed in some way, when in reality, it's just their body healing.
Yeah, but if we look at it, it's a chronic disease, that requires ongoing maintenance or ongoing motivation and self-discovery. If we and I'm going to go back to what you spoke about, where how many years we're using, 7 days is not going to put us into a new belief system, a new reaction, take us out of the fight or flight. It's like onions. We're peeling back layers. Okay, we put down the substance. 1 layer is gone. Then what's next? And it's going to continue to go that way, and having the proper support will facilitate you peeling back those layers.
Yes. And just like an onion, peeling back those layers can make you cry. But
well said.
Work that's got to be done.
Well said.
So tell me a little bit about Aftercare Decoded and the biopsychosocial recovery model.
Well, please let me know if you disagree with this, because I think it's so important when we look at physical, environmental, and our psychological well-being, correct? Sorry, I started on that one. But we have to put all of them into a thought process, into a conjunction with each other, because just because if we've gotten physically well, what about the rest? Environmental is so important, and understanding how they all either support or interfere with each other I think is gold. You know, as we're creating a treatment plan, going off of this concept, you know, putting it all into a line, how do I say this? More of an understanding of the perceived hurdles at hand, you know, and going off of that. And we can build a proper treatment plan, moving forward when we've investigated all of those aspects. Agree?
Agree. And going along with environment, I think we've talked about this before. Not everybody is comfortable. Actually, a lot of people are not comfortable sitting in a therapist's office, staring at you, pouring their heart out.
Yes.
So recognizing compassionately what environment is going to be most supportive of your recovery process. What environment are you going to feel safe enough to start opening up about those things? And for some people, it's on a jog. For some people, it is, you know, doing something else.
But that's okay. You know, and it's a reinforcement that is all right. It's not a one size fits all. You know, and it's being able to be versatile in order to accommodate each individual's likings and dislikes while keeping it productive and facilitating growth. Sure.
And I could go into all kinds of theory there, but we won't right now. We can stay on Aftercare. How long, when you work with people at Aftercare Decoded, how long do they typically stay with you?
So what we like to do is we facilitate whether you're pre-planned of saying, hey, I'm only going to do it for short time. We'll do short term, and hopefully encouraging a transition of a maintainable check-in perspective, right, as it goes. But I don't like to put explorations or concepts. What we want to do is just facilitate. Every time we get with a client, we work ourselves out of a job. That's the whole point of it. You know, we don't want to build a dependency upon a staff member or, you know, our approach. What we're doing is the training wheels while you're figuring out what you choose to maintain that's going to be the most beneficial for you and your lifestyle. So with our network of therapists, doctors, you know, we're able to network and provide a true platform of the client's choice, because we want them to know that there are options. If you see one therapist and you don't like them, don't say it's done and over with. Let's find another one and we can continue. Some people like female therapists, some people like male therapists, and it's finding what is going to work. With the doctors, having doctors who are educated about addiction and knowing the parameters of what to prescribe and what to stay away from, you know, that's going to be gold as well too. And they're going to check in, I believe, a little bit different. They're going to look at symptoms, cravings in conjunction to, here, take this, right? So it's being able to have that support. Now, time-wise, however long that takes, that's okay. That's all right. As long as you're authentically approaching with the desire to continue to grow and not just facilitating a down spiral, you know, and that's where the client's obligation comes in, is to thy own self be true, knowing, am I manipulating or am I on a real journey?
Right.
You know,
and that can be dicey sometimes, because
that's saying it like
we don't want to admit when things are not going well. You know, you can just, I got this, I just need to soldier through. And that's just not healthy in recovery, because that's what you did in addiction.
Correct.
And I think that's really important. And another thing that we learned through the co-occurring disorders model was that for most people with persistent mental health issues, including addiction, I throw addiction in there, I wish people didn't separate them.
Crazy.
But treatment and aftercare, if you will, intervention, service acquisition, whatever you want to call it, is episodic. You're going to do well for a while. You may feel like you've got it. Great. Go off on your own. And if you need to come back, or when you need to come back, I'm here. I'm a phone call away. So we're, like you said, we're not establishing a dependency. We're establishing a resource.
Correct. Well said. And that's the whole point, because dependency can kill. You know, if somebody is so dependent that they can't remove your services or be a short time without your services and then they fail, what have we really facilitated for them is another hurdle. It's one substance to another, and it's having it in a healthy dose, knowing it's available when you ask.
Exactly. What is meant by sober proofing a home? I know we've talked about that a couple of times.
So when we look at this,
and I've talked about it a couple of times in classes over the years.
correct.
It is essential.
So sober proofing homes is truly just modifications of an area that you're going back to. When we look at it, it's, some people say, okay, I can remove alcohol. Isn't that sober proof, right? Okay, that's one step. That's one aspect of it. When we go into let's say a functioning household, I'm using that lightly, but just as an example, and a client goes back to it. Now, the people who reside there have either been manipulated or been able to enable, and they don't know and it's not their fault. A lot of people receiving loved ones back don't understand the depths of addiction. Oh, you're not drinking, you're cured. Okay, you're not using, you're cured. And they let their guard down because they want their loved one to be back to themselves more than anything. But when we stop and look at the hiding places, paraphernalia, okay? We're master manipulators. There's going to be hidden stashes. Even if it isn't the substance itself, it's going to be the remnants of it. We might have certain music or certain things that are going to trigger us when we come home. And we put in all this work and we're home and we're met with a wall of triggers. And people still enabling, with the concept you're cured. So when we sit with families, what we like to do, our loved ones, however, it's looking at, we like to start in the bathroom. Always start in the bathroom, because you have your medicine counter, okay? And people without an addiction, they're not as aware of the prescriptions sitting around and or how they can be abused. So when we go in, it's understanding the meds that need to be removed or locked up safely, and the new medications that the person's bringing home with them. Allowing them to have a consultation with the doctor, letting the doctor walk through side effects, if it's going to be abused, what to look for, and then introducing a med count. A med count is big for people, a more sheet or however you want to approach it, just having it written out and the day, and it's accountability, the signature. If you're on an antidepressant, hey, your signature's there, you took it today, and this is a big approach. You would think it would be more spoken about or brought to the front line, but it isn't. Normally when we hold these conversations, the next is going through the kitchens. And the kitchens are, you have vanilla extract, and I actually forgot, in the bathroom, you're looking at mouthwash without alcohol. You want to introduce these things not to create triggers. Some people love cooking with alcohol, which is fine because the alcohol cooks out, but we don't know per person how it's going to impact them. Does that make sense? Mm-hmm. So you move room to room, and throughout this, and if they're giving accountability, such as a UA test, right? But I never given a UA test, but I'm holding you accountable, and I'm gonna act accordingly, but I don't really know how to read it. So we include the concept of what a faint line is, to two positive lines, to one line, and we walk them through, because I've seen people lose their housing over the faint line on the 12 panels. The two mean positive, one means negative, right?
Yes.
I'm sorry, go ahead.
That's one of the things that drives me crazy, because those urine tests that you're talking about, the pregnancy type urine tests, they're screening tools, and nobody should ever lose their housing over a screening tool. But I digress. But lines and
but this is
what you were saying.
But this is why the sober proofing homes are so important. Helping them create healthy routines in the home. Okay, if you're feeling depressed and you can't get out of bed, a lot of people say, well, if you're in bed, you're not drinking, it's okay. No, what you're doing is you might be facilitating that down spiral. So as long with substance, we're looking at the culture of the home, culture of home, substance, and preparing. And so that to me is a true sober proof. It's not just removing the alcohol or drugs. It's allowing them to remove things in their living environment that are triggers because a part of their lives, a huge part with using or going through depression and feeling the pain are connected to a lot of these items. So we facilitate the voice, because if someone just comes home and says, listen, I'm uncomfortable, a loved one normal reaction is, are you okay? Are you about to relapse? But they don't say, okay, well, walk me through what's happening. Mm-hmm. And understanding emotional connection and a regulation is a big part of that stability.
And some of the things we've talked about that I don't know if they fall under sober proofing the home, but helping the person in recovery recognize how supportive their the people living in their household, family, loved ones, whatever we're going to call them, are going to be. Because sometimes those people have not been involved at all in treatment.
Yes.
It's like, it's your problem. You fix it. When you're fixed, come back. And unfortunately, they sometimes have difficulty looking and recognizing, hey, maybe there's some stuff I need to work on too, that either developed prior to the relationship that led me into it, or as a result of the relationship, or both. But I made the analogy before of families, and actually somebody in family therapy did this one time. I'm just stealing it. Families are kind of like a rubber band. And if you hold that rubber band out, you want to hold it in a circle. And if one part starts to pull out, the rest of it wants to go and reform that shape. It wants to maintain that shape. And so the person in recovery, when the person comes back and they're in recovery, they're pulling that family out of shape. Those family dynamics are changing. And the natural response, often not conscious, is to pull that person back in.
Well said, because here's something, just piggybacking off of that, because just because the person might have done 60 or 90 days in treatment and allotted themselves time to heal, the people at home still have open wounds. We don't know what extent they have allowed themselves to start healing before receiving the other one. And that dynamic, it's like the crab bucket motto. It's like where the crabs try to come out, but the other one pulls it back down, and it's instinctual. Mm-hmm. And in a dynamic, we were all put into a role, voluntarily or involuntarily, within that dynamic, but the dynamic itself wants you to act accordingly. And just because your drinking or drugging might have stopped, the dynamic has to be reconditioned to receive you, not to go back into that settling dynamic, right? Does that make sense?
Sure. And so sober proofing the home, in part, also may mean taking a very real look at what the people, not only the things in your house, but how the people in your house may be supports or triggers or both.
Well said. And that's one of the staples into it, because as we're going through the house, you can get a read. If the person is aware or unaware of what's going on, the interactions, and that's where you start introducing, the family dynamics, where you get a family therapist, and you continue to, or CODA. CODA's always been a good one, codependency. And you start in the plan of sober proofing the home, start introducing these things, if you hadn't had a chance to discuss it in advance. But it's always the best platform for it to be received, and that's absolutely right. So you're looking at energy, vibe, dynamics, and substances as you're proofing the home. And accountability overall. You don't want those who manipulate to continue to manipulate. You want those who are afraid to be transparent to wind up not finding their voice and saying, this is not okay.
Right. And we find that both the person with the addiction as well as the non-addicted person, if you want to go there, they're both manipulators.
Correct.
And to use the labels that I really don't like, the codependent and the addict are both manipulators. So it's important for each person to recognize how they manipulate, why they manipulate and what they can do instead. How do I approach this instead of being manipulative?
Absolutely. And here's the thing is survival is survival, and manipulation becomes a superpower. You know, I always use this example, like if you were to go to Superman and say, look, you can't fly, you can't use your strength, you know, your multiple strength or your laser beam eyes, but I still want you to go fight crime. She's going to have a moment of, wait, what? You know, it's not going to make sense. But in the same manner with the enabler, you know, manipulations. And what we're doing is cutting this out, but asking them to still coexist,
Right.
or still going to each day as their own superhero, but taking away what they perceive to be their superpowers. Mm-hmm. You know, and it's interesting what that brings to surface and the why. Why do you need that? Why do you feel that that has that much value to keep it as a staple routine or staple survival approach with manipulation, you know, and so on and so forth. But it really does allow the facilitation of healing to begin.
Well, and I like that, you know, I like metaphors. So going with that Superman metaphor and looking at what the kryptonite is in that relationship.
Oof, yes, yes.
That could be really cool to explore too, but I digress. What is the biggest mistake you see people make when they're leaving treatment? And I know you talked about assuming that they're cured, but are there specific mistakes?
Yes. I'm going to try my best to keep it organized, because my mind, I'm having so much go through it right now. It's not an easy, it's a great question, multiple answers. Because when we look at it, let's look at some different types of scenarios. I see it very common that once we feel that we are at a place where, if you want to call it the pink cloud, however you want to call it, but you feel ready, there's this unsaid false urgency of somehow making up the past, maintaining now, and planning for the future. And it overwhelms everybody because the past is the past. It is what it is. You can use it as a learning experience, but we cannot go into it with exceeded energy expecting to make a difference for what had happened. People get it confused. Well, if I think about it, I stress about it, that means I'm being proactive about it. But all that is burning up unnecessary energy and false beliefs of keeping us stuck, right? It's going to keep us stuck. So if I'm not thinking about it, I'm not taking it serious, that's a false belief. And I see that as we're ready to tackle on the new obligations, looking at each individual relationship, carrying in the flaws, overly promising, I won't do this again, and I see my pain, and expecting the expectations. A lot of expectations coming out of treatment. Expectations are just should be resentments, you know, and as we're holding people to expectations, I apologize. I said, well, receive me the way I want to be received. It's not organic. We can't force these things. It has to organically occur for the healing and the reconnection. So between the energy, the misplacement of energy and expectations, and or walking out with shame or embarrassment for the things that we did discover, you know, not realizing we were manipulators, or not verbalizing of our understanding of being a manipulator. A lot of times people will say, okay, if I don't say it, it won't be brought up, I won't be embarrassed. But it's then, where's the accountability for backsliding into it? Or work will save me. As long as I go back to work, no one's going to complain that I'm making a paycheck, you know, fixing debts, you know, maintaining a household. But work is the one that you'll get applauded for, but it becomes the biggest distraction. It's a way of not holding ourselves accountable. If I'm at work 14 hours, well, then I don't have to think about my cravings, but we're not discovering why they're happening. I'm not looking at, you know, the pains and everything else that has been exposed because I'm at work. I don't know if that makes sense, if I explained that properly, but.
It does. And also you talked about the shame, also letting the others get away with continuing to manipulate you with shame, reminding
Yes.
you, well, we wouldn't be in this place if you hadn't ...
Yes.
And that in and of itself is toxic. And yes, they are entitled to their resentments, but lording them over somebody is not productive. It's just like dwelling on your own shame and dwelling on, you know, your own fears. It doesn't address the issue, it just burns up a lot of energy. And
It's the truth.
A lot of times you hear somebody tells you something about yourself enough, you may start believing it. So we start seeing the person with the addiction backsliding because they start feeling more and more shame and more guilt and more helpless.
Yeah. You know, I'm thankful you brought that up, because that's one of our biggest desires is investigating our self-talk. You know, we manifest our self-talk. You call yourself stupid enough, you're going to do things to co-sign that belief and make sure that it's valid, right? And feeling less than really puts us into a box. We limit our success. We hinder our growth because we feel that, whether if it's the shame of others or I don't deserve this. You know, I like the idea of karma, but I don't like when it's weaponized. And people in recovery or addiction weaponize a lot of these things because it's saying I'm getting what I deserve and that's okay. You know, and they'll continue to gravitate towards things that are hurtful because we feel that that is the just response for the things I've done in the past. And that's really not fair, but it becomes that belief. So when we look at positive, negative self-talk, or the narrator, the inner critic, where is it stemming from? And why does it hold so much power? You know, and we start buying into it, you know, and it's being able to diffuse or rewire that has been great for the reintegration of dynamics as well, too. You know, and it's being able to continue to expose the false beliefs that we carry around as core beliefs.
Mm-hmm. And I think another mistake a lot of people make is not going back far enough. They look at when they took their first drink or smoked their first joint, and they fail to look back at their attachment issues, their abandonment trauma, all that stuff that prevented them from being able to be healthy, whole children. And whether you believe in the concept of the inner child or not, we have these memories of childhood that are either good or terrifying and shameful and, you know, fill in the blank. And, you know, that if we're holding on to a lot of that distress, then we need to process that. We need to help that part of ourselves feel safe, help us recognize what we were and weren't responsible for back then, and how we're different in the present, how we're safer in the present. You know, we're grown-ups now. We can protect ourselves, whereas when we were 8, not so much.
Well said, and that's you know, it's finding that courage and belief. That's the personal work, right? That's the personal journey. Mm-hmm. As long as we have this right supports facilitating us to these conclusions, you know, then it's freedom. We realize we're not connected to them. Right.
And I think a good, do you call your staff coaches?
Well, it depends, because our core employees are consultants. Because we facilitate you to the professional needed. Mm-hmm. And if I can use an example, like if it's okay to bring up a facility's name, is that all right? Okay. Yeah. So one place that I love, and they've continued to show themselves year after year and time after time, is Comprehensive Wellness Center. Okay. They're down in Lantana, Florida. And I feel lucky when I get to facilitate groups in that realm for them. And it's because of their professional structure. Their professional structure is so tuned in. When you, not just credentials, I don't want to just go credential route because that's important, obviously, for legalities. But when you take away or not harp in on the credentials, but look at the people, and you start seeing the specialties, their special niches, and you allow them to bask in the niche in which they found along their own journey. And the clients benefit from it. You know, they're willing to extend staff to have each special technique, perspective, or talent, a diverse menu, and not saying, okay, here's one facilitator, deal with it. You know, you have a couple choices of a primary, deal with it. But it's allowing the natural occurrence to have a healthy choice, to have a healthy option and selection of discovery. And the way that they step down clients is so thought out. And I have a lot of facilities I enjoy working with. You know, I've been very lucky, from the court systems to the state to private. I've gotten exposed to a lot of it. But when you look at the step down methods of looking at immediate needs and long-term needs, while finding the right approach to help connect the dots, you know, it's not pulling the plug, saying good luck, but it's not becoming a system to where you're dependent on.
Sure.
And the thought process, the clinical meetings, the thought that goes into each client is just so unique. Now, we got into a project, and I was so thankful to be a part of it, was the virtual IOP. At first, I didn't know what to think. Like right now, to be honest with you, I'm a little nervous. We're on virtual, you know, on the screen, and it's because you know, you're a role model of mine, and so for, you know, I feel a little shy. But at first, I didn't know how to take the video, the Zoom, and there's energy in a in-person group. There's you got the energy, a lot of personality. The vibe is different. And CWC said, we want to be able to help anybody, anywhere, anytime within our parameters, right? Within our legalities. So we started looking at it, and Dr. Snipes agree or disagree, because when we go back to what are some of the hurdles when people leave treatment? Well, the meds are normally the first things discarded, right? The meds, they'll go through the punch packets, they'll go through the last scripts. Oh, I don't need them anymore. I'm okay. Then the idea of a month, 3 weeks of finding a primary, I don't need it anymore. I'll just go to work. So now you're eliminating the medications and routine. Now you're eliminating the primary. So now how likely are they? And I don't know statistics, that they are going to go to meetings, or they are going to on their own go to groups. So now what we've done is everything that's helped you grow winds up when you go home falling off. So what they did was able to create an app. You log on. Now, as you're getting discharged, or step down rather, not discharge, step down, you keep your medical provider. They already have a report with you. Your medications aren't interrupted. Your primary is not interrupted. You know, if you're part of specialty trauma, like trauma therapy, specialty therapies, you can continue with that. And we also facilitate group online. So whether you're at home and you can't make the drive, because work does become an inconvenience at 6 to 9 p.m. And a lot of times people don't get out of work until 5. But it doesn't mean we stop growing. It doesn't mean that we stop challenging ourselves. So with their care and their approach, it's been a blessing to see the transformation of treatment being, or evolving in this new age of technology, and having technology meet compassion, and having it go hand in hand, and look at what it's manifesting into. It's an amazing trip, you know? So when we look at it, there are some facilities who are really in tune, and other that are just, I don't know, old school, just existing. Not to throw shade or to say anything negative, but this is what we wanted to do with Aftercare Decoded, is know with detox, there are options. With residentials and PHPs, the partial hospitalization programs, there are options. Just because they take your insurance does not necessarily mean they're a fit. Challenge it, because if they do not have dual diagnosis and you're only going in for substances, what are you missing? You know, and if spirituality and church is a big part of who you are, finding one that facilitates that approach too, that's going to be a blessing. You know, not to give enough choice to weaponize, but to give enough choice to grow. I don't know if that makes sense, Dr. Snipes.
And yeah, every individual is different, and not every treatment program is individualized. And I think that is a big mistake.
Yes.
In my humble opinion. Maybe not so humble opinion, I think it's a big mistake. So it is important to make sure that we're providing options for people, so they find a place and they find a program that works for them based on their particular needs. If they've got PTSD, if they've got addiction, if they've got, yeah, alcohol
Absolutely.
dementia, whatever it is. So I think all of those things are really important, and making sure that that transition goes smoothly. Like you said, not kicking somebody off the rolls and saying, okay, well, here's 30 days in meds, good luck.
But, you know, unfortunately, that has happened in the past.
It happens a lot, not in the past. It happens a lot right now, and it's heartbreaking.
It really is.
It's heartbreaking to see people feel like they're starting to get their land legs, and they walk out. And I'll tell you myself, when I have to make a doctor's appointment or something, I put it off. And I hate making doctor's appointments. I hate going to doctor's appointments. And I think a lot of our clients feel the same way. It's overwhelming. They've seen doctors. They've been dismissed. It's been a very traumatic, or at least demoralizing experience. So it's hard for them to even think about trying to find a new primary.
Absolutely. And the stigma, the perceived stigma that we feel when going to a doctor, are they going to look at me different? Mm-hmm. You know, that creates a wall in between receiving the help that you did in a facility to outside in society, because there's a perceived stigma. And knowing what doctors to go to, some doctors do not like patients who have an addiction, right? And that's their choice. But knowing who has gone the extra mile to have the compassion and understanding of our community, our community's needs, you know, how we're our vulnerabilities, and being exposed to just triggers and you know, just because a guy in a white coat writes you a prescription doesn't necessarily mean it's for you. Because if we look at, ready for this, monsters, coffee, society deems it to be okay, but how many people abuse that out of proportion to get a rush out of it and say, well, it's fine, it's only coffee. Mm-hmm. So if a doctor's handing you a prescription that could be addictive, doesn't necessarily mean it's meant for you. There are other options. There's other avenues to get the same help without that vulnerability of walking into a new anchor, a new tug in your walk.
Mm-hmm. Exactly.
You know.
So in closing, you know, we've talked about a lot of stuff today. What is the most important message that you really want to drive home to people with this interview?
If I can narrow it down, and I'm hoping I can do our community and some service, is when somebody is receiving help, there's a natural process to this help. You know, just because it looks like flags from somebody doesn't necessarily mean it's flags. As we're learning our new selves, nobody's perfect. There's learning curves amongst it all. But meeting them where they're at, don't overdo it and don't pull back. Meet them at the exact place they're at, because you cannot save them. You know, and at the same time, shaming or that tough love may not be applicable. So knowing that if we can all remain open-minded, don't judge off of the first glimpse. Do your investigations of understanding emotional, physical, and environmental. Looking at what the person's going through and what you're bringing in. And the biggest thing is this: people who care. But just because we care doesn't mean we know it all. You know, we have to build a network. We have professionals, we have communities. And what it's about is not being in-house taking care of it, but allotting a network to come together to help that growing. Like I said, just because we care doesn't mean we know how to care. And it's being open-minded to receiving suggestions. And it doesn't mean you're less than or you've done it wrong. It's a growing platform. And not taking everything so personal through the growing periods. Allot yourself breathing room to not be okay. Allow yourself the patience if you feel like you're slow learning, but you're still learning. And the people who are connected to people getting well, let go of the past There's a time and the place to bring up the past to heal together. We cannot negate it, but there is a lot of time for healing. The more we remind and judge from the past, the person will resort back to the past. Mm-hmm. So if we're going to have this perceived clean slate with encouragement, let it be so. Don't falsely advertise, I'm going to take this journey with you just to be an emotional, verbal abuser because you're still wounded. Mm-hmm. Does that make sense?
It certainly does. It certainly does.
But it's all about being able to have a network. One person might be great at one thing, but not the other. And it's not limiting yourself to the idea of being stuck. If you're going to hold accountability to a loved one, say, how do I hold accountability? What is the right thing to do to remove my bias or my perceived, thoughts of what I see going on? How do I find the truth? And for those who are looking to integrate back, being open-minded to the suggestions and the accountability. Accountability is a victory, not a punishment. Every time you're held accountable and you pass a drug test, a question about drinking, where you've been, and if you're authentically honest with your actions, it's another victory in your new walk. Mm-hmm. And embracing it as so, because we've created scars and we've endured scars. There is no entitlement to say you can't hurt, but it's our job to heal. Mm-hmm. And that's all it is. I don't know, Snipes. If that works, I hope that comes across. I'm very passionate about seeing people succeed. We don't just say after treatment, it's up to you. Success is available if we understand the definition of success. It's not a Ferrari. It's having a happy, healthy life that we can embrace and be happy to wake up to. That's success. Knowing that you have the best intention for your loved one, not how much money can I get out of you,
I remember one client I had one time was so ecstatic, came to group, and they had been out of residential for, I don't know, a few weeks, and they came to Aftercare, and they were just so ecstatic that they had been home and they'd been asleep, and somebody came knocking on the door. And their first thought was that it was either their dealer or they were going to get arrested. That's the way it had been so many times for them. But instead of doing what they had always done and hidden and tried to avoid answering the door, they got up, they answered the door, and it turned out to be nothing. It was like a solicitor or something. But they were so proud of themselves for recognizing, hey, I've been doing the right things. I've been doing the next right thing. So logic would tell me this probably is okay. And they got up, they faced their fear. And in that particular case, it was rewarded. And it was like, yes. And this is what happens when you start taking those steps forward and doing the next right thing, then generally the other side of the door is not so scary.
Amen. Well said. Just to recap, Dr. Snipes, while I have this opportunity, Aftercare Decoded, we named ourselves as Aftercare Decoded because that was my passion, but the need has made us expand. Just to recap, if people are looking for help, we can set you up with the interventions. We run verification of benefits. We explain the different treatments that are available that are covered by your provider, perhaps, right? We get you in contact with a professional to do an assessment. From that assessment, you get approved, right? And then what we do from that point is when the person is in treatment or detox, we work with the back end. We start getting the family the right professionals that they need, and we start preparing them to understand, first and foremost, what addiction is, why it's not just a choice. And I'm a firm believer, it's not just a choice, okay? Like it's not, hey, I'm going to brush this off and I'm good. No, understanding the whys, the hows, and all of our actions in it. Not the shame or guilt, but understanding like the family dynamics. But then allowing the loved one to be exposed to what they may need, whether if it's CODA and or, their professional, their therapist, while setting up before the person comes home, a family therapist or a couples therapist, and having that already in action so there's no delay, and also what medications they're coming home with, and understanding the importance and the side effects, getting them to a medical provider to walk them through all of this. So we're literally in a position of intervention all the way through to aftercare. You know, and
I
that's
say case management,
fair enough.
because you're really linking people with all of the resources that they need based on their biopsychosocial presentation.
Correct. And that's the whole point of it, because the parents or loved ones send people away and then they're not connected.
Right.
They're not up to date, and they're in a pause, a pause manner where they have to wait for the loved one to come back to start understanding what they should be doing.
Right. And that's
You know,
actually true if the loved one goes to treatment in another state or another city, where visitation and family education and all that stuff may not be possible. So I think your service is really important to help integrate the family into the process and
it's so important.
environment, because treatment, even really effective step down from residential to IOP to aftercare, that's for the identified patient. And unless you get the family involved, they're going back into a toxic environment. And
Setting them up to repeat what they got out of.
exactly. And expecting them to have the wherewithal to be able to explain everything to their family in clear and concise terms, when the family is like, well, we don't have the problem still, is unfair. So I really love what you're doing. I love talking to you today. You really make me want to go back and work in residential. But
let me know, please. We can run groups and co-facilitate together, Dr. Snipes. That would be a dream.
oh my gosh, I may very well take you up on that. So anyway, I look forward to talking to you in the future. Maybe we can touch base again on topics as they come up, as they relate to addiction. Would love to hear some of your thoughts on sex addiction and compulsive gambling.
Oh, that I would love. You give me the invitation and I will be there, Dr. Snipes.
That's awesome. Well, Paul, it was great talking with you today, and I look forward to our next interview.
Thank you.